Welcome to the Copeland Coaching Podcast, where it's all about turning your job search into a slam dunk. Your host is Angela Copeland.
Welcome to the Copeland Coaching Podcast. I'm your host, Angela Copeland. Live on the phone with me today, I have Joel Go from Harvard Business School in Boston, Massachusetts. Joel is an assistant professor of business administration in the Technology and Operations Management Unit. He also recently partnered with Stanford University on a study regarding the impact of work stress on your health. Joel and his team released their findings in a paper titled Workplace Practices and Health Outcomes, Focusing Health Policy on the Workplace. Joel, thanks for joining me today.
Thank you.
Well, it's great to have you here. I mentioned before we got started that I first learned about your paper from a local television station here in Memphis who was wondering about how stress impacts people who are looking for jobs. And a lot of times, one of the number one motivators to look for a job is work stress. So I got a chance to look through your study. I really enjoyed it. How did you decide to put this study together and to look into this issue?
Yeah. So thanks. Firstly, thank you for having me on the show. A couple of things about how we put the study together. Firstly, the group, our team, myself, Jeff, and Stephanos is a team of co-authors. We're a pretty eclectic team. Jeff is an organizational behaviorist, and Stephanos and I are both sort of mathematical modelers. And so the start of this really came from Jeff, who was reading a bunch of this stuff, start looking at a bunch of literature looking at the impact of stress on health, and there was this consistent finding that various types of stress affects various specific health outcomes in certain ways, and it seemed that there was broadly a consensus that this stuff mattered. Now, what we found was missing in the literature was, in a sense, all of us are sort of management scholars, and so we were interested in what's the overall impact in the workplace, and how do we sort of summarize what is the findings of the literature? We sort of intuitively, from our perhaps initially biased view of the literature, felt that that this was a big issue. But can we sort of do this in a more systematic way? Can we apply some rigor into this to try to see whether or not there was an appreciable effect? And can we sort of think about, as management scholars, what does that mean? What are the implications for us as we think about thinking about better management practices, better ways that we can run businesses, essentially. Yeah.
Oh, that makes sense. So how long did the study take? When did you start and when did you kind of finish?
Yeah. So the study took a long time, and it started in around 2011, 2012. I don't remember exactly. Mm-hmm. And this is not just this is a multifaceted study. So the paper that you're referring to is one of a couple of papers that we've worked on within this realm. We originally conceived it as one paper, but we felt that it was too big and sort of disfocused to put everything in one paper. So we sort of broke it up into different chunks, addressing different sort of issues, within the same sort of space. Yeah.
Oh, that's interesting. So what kind of chunks do the other papers address? Like what are those topics of those other papers? So
in a sense, we started out as management scholars and as sort of modeling kind of people. We were really interested in cost and sort of the effect in the workplace. And so that was a paper published in Management Science where we built a model to look at what would be the overall impact of this stuff on sort of the U.S. to mortality and to healthcare expenditure in the U.S. And in a sense, that was what was the driving force that motivated a bunch of the rest of these papers. Through this process, we actually realized that we needed a systematic way of thinking about what would be the impact of workplace stress on health, which is what led to this study that you cited, that you sort of referenced. We realized that we needed. It took us a lot of time to sort of go through the literature and to do this systematic analysis carefully, and so we published that in a separate paper, and we used the results of this paper to inform how we would build the model in this management science paper. In another paper that has just come out, we were using the results of this model to study disparities in health inequalities. Yeah.
Oh, that's interesting. So how did you go about performing this particular study? What was the process like?
Yeah, the process that we undertook is known in academic speak as a systematic review and meta-analysis, and this is essentially a way of summarizing a literature. Now, the common way of when we think about summarizing a literature, perhaps the most intuitive way that most of us are used to is, in a sense, what is called a narrative review. And what this means is, well, we read a bunch of papers and we sort of write out just in text form what the overall status of the literature is. Now, that's really useful, but as quantitatively driven people, we kind of wanted a number. We kind of wanted what is the average finding of the literature. And so what we undertook this process called a systematic review and meta-analysis, which essentially is a two-step process. The first step involves the systematic review part of the process is how we choose these studies in a way that that tries to minimize our personal biases. So we sort of set out guidelines. We sort of say, okay, we're going to have criteria, well-defined criteria for what studies we're going to accept and what studies we're going to reject. And we basically are scouring the literature for medical studies that do this kind of that study this kind of effects. And in the second phase, in the meta-analysis phase, what we're essentially doing is finding an average of these studies. What in aggregate do these studies say? And the objective of doing this is to say, well, we're aware that different studies are going to invariably find different kinds of results. Well, this particular stressor affects this particular health outcome in a particular way. And so we're really trying to find out, roughly speaking, what is the average finding from the literature. And so what we're reporting in this paper can be viewed as, based on our sample, the average finding that we found.
Mm-hmm. Oh, that's interesting. So it sounds like you were going through pre-existing studies and you were analyzing them to find some common threads. Is that true?
Yeah, that's true in a quantitative sort of way. So we aren't going out to survey people ourselves, but we're looking at what has been published in the literature, and we're extracting these studies, and we're looking at these studies and reporting what is the average finding from these studies. Now, the selection part of this the selection phase in this process tries to ensure that we are not biased. We're not sort of just picking out the stuff that supports our pre-existing beliefs about what the result should be. So in a sense, we're trying to act as impartially as we can.
Sure, that makes sense. So how many studies did you look at when you were doing your research?
The final number came up to be about 228 studies that met whatever the criteria that we had.
Wow.
Yeah.
That's
and this
a lot.
was winnowed down from a number of we started with a database search that came up to be we started with 7,000 sort of studies that matched our original search, and we winnowed it down based on different kind of criteria.
Wow, that's a lot.
Yeah. So this took us a long time. So I think this part of the project took us, I think, the most amount of time. It was pretty labor intensive, and so yeah.
Well, that's great. Well, I mentioned to you before we got started that a lot of the publications that are citing your work are mentioning the fact that it's a partnership between researchers at Harvard and Stanford. So you're at Harvard now. How did you make the connection to Stanford?
Yeah, so I was a graduate student at Stanford Graduate School of Business. One of the co-authors on the paper, Stefanos Zenios, was one of my PhD advisors at the time.
Oh, that's great. That's really great. So I understand that through this process that you actually developed a model of 10 stressors that you can use to measure outcomes, health outcomes, and in particular 4 health outcomes. Can you share with us, I guess, first, what are some of those stressors on your list of 10?
So I just want to be a little bit more precise about the language. We didn't develop this model.
Okay.
In a sense, the 10 stresses were identified based on in our initial sweep through the literature. It seemed that these were the 10 that were mostly well studied in the literature. So in a sense, we can't really take credit for coming up with these 10. This has been sort of the prevailing sort of view, I think, of the literature.
Sure.
But in that sort of sense, some of the 10 that we studied were things like job insecurity, how I guess in simple words, how a worker or an employee feels that their job might be at risk or unstable. Some other stresses we looked at were things like the lack of health insurance or high job demands, the presence of shift work, or sort of a low sense of control over one's job. Yeah. So and the list goes on, and I think, but these are some of the stresses that we studied. Of course, different stresses had turned out to have different impacts on health, and the 4 outcomes that we studied were again weren't really chosen by us, but they were sort of chosen by, what is usually studied in the literature, and these are the 4 stresses were the 4 outcomes that we looked at were poor self-reported health, poor self-reported mental health. So I guess the first would be poor self-reported physical health, so poor self-reported mental health, the presence of a physician-diagnosed condition, and lastly, death or mortality.
Wow. So it's interesting you mention with regards to the stressors, the first jobs insecurity. I know for a lot of people, layoffs are more common today in corporations than they once were.
Yeah.
I would assume, is that the kind of thing that you mean when you say job insecurity, that something like that could potentially happen?
Yes, that would be what we mean by that. We sort of have a slight distinction between layoffs and job insecurity in the sense that we look at unemployment as a separate category of stressors. But in a sense, job insecurity we sort of think of as, well, when someone is still employed but faces the imminent threat or faces a perceived threat of job loss. That's how we sort of conceptualize what job insecurity is.
Right. That makes a lot of sense. And it's interesting. Just yesterday, I spoke with 2 people who described having concerns and fears around healthcare through work.
Yeah.
One of the people had gone back to school to obtain a new degree to change careers. And after graduation, this type of new career was she would be self-employed. And she immediately decided she should not pursue that new career because she was not comfortable purchasing healthcare. And she went back to a corporation, to her old role, even though she had pursued and obtained an entirely new degree, but the only reason was the healthcare. So I find that interesting that was one of the top ones on your list.
Yeah. Yeah, it does turn out that, in a sense, our study is a little bit dated regarding healthcare, because some of the data came from before the Affordable Care Act was passed, but I think some of the insights still sort of hold to a fairly large extent, I think.
Yeah, no, I would agree. I would agree. I hadn't even thought about that. Do you plan to do any follow-up research since the Affordable Care Act was put into action?
On this line, we have a couple of papers that we're working on right now. I'm trying to think. Yeah, does it really apply to? Well, we have a couple more papers in the pipeline. It's with research, it's always sort of hard to tell how it goes.
Sure.
And so yeah, we're going to wait a little and see.
Yeah.
But,
No, that makes sense. So throughout your research, did you have the opportunity at all to sort of talk with individuals, or you were only looking at data that was pre-existing?
We are mostly looking just at data. Yeah, we are sort of quantitative.
Yeah, that makes sense.
Data crunching type people. Yeah.
Yeah. Well, your study actually mentions, and I don't know if you compared this or if maybe the media has compared it, but I've seen a couple of quotes that says that work stress is as bad for your health as secondhand cigarette smoke.
Yep.
Was that something that you
Yeah.
came up with?
Yes, and maybe I should put it in a little bit of context. So what happens was that in publishing this paper, we published we sort of put what's the right word? Yeah, we reported the results in a metric known as the odds ratio, and that turns out to be a little bit difficult to interpret for people, and so our objective was to give a benchmark for what an odds ratio of 1.5 sort of means. It's sort of a number that is hard to conceptualize. And so we were looking at into the literature to look at various kinds of stresses or various kinds of negative exposures, if you will, that had effect sizes that were sort of similar on each of these four outcomes that we were looking at. And we turned out that we found that secondhand smoke, there were sort of fairly consistent findings in the literature for the effect of secondhand smoke on these stressors that were roughly, the same, roughly similar, maybe that's a better word, to what we had found for the job stresses that we had looked at. And so really it was a sense just to benchmark, to give people a sense of, what these numbers mean in practice, and so that was the objective of sort of putting that benchmark out there.
No, it demonstrates it really clearly when you put it that way, and really we take secondhand cigarette smoking very seriously, at least most places.
Yeah, so I think the idea, and part of what we were trying to do with that was to say, and part of what sort of going back a little bit to what prompted the study was, there are lots of things that we have done, say, with secondhand smoke, with a bunch of other things like workplace safety that we've paid a lot of attention to. But our sense was that there hasn't really been a lot of attention being paid to workplace stress and how we think about organizing the workplace that is creating stress for the employees that ultimately might be just as damaging to health as an environmental or a physical sort of exposure to, say, in this case, secondhand smoke. And so our objective of performing this research was partly to say, can we firstly find whether this matters, and if it does matter, can we perhaps to shine a light on this and perhaps ignite some either future research into mechanisms, into more detailed analyses, or to just help people to start realizing that this is a big issue. And so we start a conversation about it. And together we can find hopefully some ways of thinking about better ways of managing and things like that. Yeah.
No, absolutely. It's interesting. I actually gave a talk last week to a group of employers who are having a hard time recruiting and retaining talented people. Uh-huh. And they asked me to come in and speak from an insider's point of view of what bothers people, what are they thinking about when they're looking for a job. And I cited some of the things from your research about...
Thank you.
Yeah. about this kind of stress and how it makes a big difference. I have found when I talk with job seekers that they are often willing to take, for example, less money if they work in a better environment.
Yeah.
And I think sometimes employers look at it as just money and that, I pay you, so you should be happy to be here. But I think there's a little more to it than that.
Yeah, that's right. And I do think as well that some employers, especially some of the bigger employers, do care about health costs themselves. And I guess framing this as ultimately you're going to save money in the long run might be something that may be persuasive to them. Hopefully.
That's very smart. Yes, big companies really focus a lot on their revenue and their costs. And so putting it into these, numbers makes a big difference. Well, so a quick question. When you talk about the odds ratio, do you mean sort of like the likelihood that you will have a certain condition or the likelihood that you will have a certain result? Is that do I understand that?
I guess to be more precise, it refers to the incremental likelihood that you would have a certain outcome if you had one of these stresses versus not. If you didn't have, if you were not exposed to one of these stresses.
And are the increments over time? Like the longer you're exposed to stress, the more likely?
No. So what we did, and this is partly a simplification on our part, or the model from our part. We sort of simplified. We used a fairly simple model to reflect. Partly this was because the literature was quite varied in how they treated this, and partly because some of this was how it was done in the literature. But so there are two simplifications that we did in our model. We firstly only considered, in a sense, a binary model of stresses. So in other words, stresses are either on or off. You either have it or you don't have it. And of course, that's a simplification from reality, where often it is there's a scale, right? There's you're mildly stressed or very stressed, or in somewhere in between. And the other sort of simplification that we took was that we sort of didn't really model dynamic or time-varying effects. And so we sort of have what is called perhaps a stationary sort of model, where we're looking at sort of an effect that's sort of associated with an incremental probability of one of these things happening. But without sort of without sort of explicitly modeling sort of period of time or the exposure duration.
That makes sense. I'm sure you were kind of working within a lot of boundaries, given that you were looking at other people's data.
Yeah, but intuitively, one would expect, for example, the degree of stress and the sort of the time that over which that one is exposed to stress to be correlated with a higher propensity, if you will, of some of these negative outcomes occurring. Mm-hmm. So I think that's not too far of a stretch, I think, to imagine.
It would make sense. I mean, I know visually when I speak with people who say are caring for an aging parent or a grandparent, or who are in some type of personal situation that's very stressful, you can almost see them age more quickly when you look at them. But of course, that's not scientific.
Well, I mean, I think that's part of the intuition that we, our common observation that led us to sort of like think that this stuff mattered.
Mm-hmm. Yeah. Well, so you mentioned you are a numbers person, and numbers are, what gets companies to take these things seriously. How much money as a country are we spending every year on health issues related to workplace stress?
Sure. So we ran a model. So based on the one of the other papers that we did, we developed a model to estimate this. And as the caveat that we give is that, well, all models are wrong, but some models are useful. Mm-hmm. And so within the limits of the model, we estimated something on the order of 5 to 8% of national healthcare expenditures that are associated with these sort of stresses. Mm-hmm. And about 120,000 deaths per year are associated with the aggregate effect of workplace stresses. And there's also something on the order of 5 to 8% of overall mortality.
Wow. So you said 120,000 deaths per year. Is that right?
Yep, that's right. And about 5 to 8% of annual healthcare expenditure.
And in dollars, what does that percentage translate into?
I'm looking that up right now. I want to say something. I don't have the number.
The number that I saw was in the ballpark of like $190 billion.
I think, that's on the upper end of what we had estimated. Because when we built a model, we sort of ran a bunch of scenarios. The conservative end is something like about $110 billion to $190 billion. That would be the upper end of that.
Well, either way, that's a lot of money.
Yeah.
That's amazing. So it sounds like part of your argument is that, if companies would pay more attention to this, they would save money on those healthcare costs.
Yes, I think that is part of what we that's part of what we were hoping to get with this study, that ultimately this stuff costs us money in the end. Mm-hmm. Now, in the context of a specific company, that it really depends on how all this works. The mechanisms by which this works are not well established, I think. Mm-hmm. And so it's hard to say exactly how much a company will save from this. But I think the broader picture is that this does matter. And the specifics of how much a company will save, of course, will vary from company to company. But I think just broadly speaking, the evidence does seem to point in the direction that, well, this does have fairly large economic implications for and for the country, for companies as well. And this is really something that we should probably be paying attention to more so than we have right now, I think.
Mm-hmm. I agree. I've noticed that your work has been cited in a number of publications. I'm sure you've been approached by a lot of people. What types of people have been the most interested? Has it been big companies, or has it been sort of psychologists, or who's interested in learning more about your study?
At this point, it's been mostly reporters.
Okay.
I've been approached by also people who work in organizational behavior, who show more of an academic interest. People who've worked in this sort of spaces of occupational medicine, and occupational health has contacted me about this. And I think from an academic point of view, I think that's where this sort of work tends to lie.
Mm-hmm. Yeah, that makes sense. Well, so I have a few questions that we talked about that may not apply necessarily to your research, but
Sure.
You have kind of been, engulfed in this concept for a while. I'd love to sort of maybe get some personal feedback on
Sure.
what you've sort of seen.
Yeah.
The first one is, as an individual, if we find ourselves really stressed at work, are there things that we can do to try to avoid the negative health implications that you mentioned?
Yeah. So, I guess with the caveat that I'm not a psychologist or I'm more of a applied mathematician.
Sure.
I think a couple of things that sort of I've been reflecting upon as I was thinking about these questions, and as we did this study, I think one of the things that struck me from this study was how much of these stresses come about from, say, job design, and how much of this, in a sense, are under the control of or are influenced by what managers do. And so I think beyond the usual sort of recommendations of, you could talk to psychologists, you could sort of seek counseling for immediate sort of help. One of the possible avenues might be to engage management and to see if there can be things that can be worked around based on how, say, demanding the job is, or if there are sort of conflicts between one's family life and one's work commitments, which is one of the stresses that we found. Are there ways that one could work around that, of course, in collaboration, in sort of consultation with one's boss or manager, to see that something that might be mutually acceptable. And so I think that's one thing. And another thing that we found in the study was that sort of the lack of support at work was also a stressor, not one of the major stresses, but it was there. But by that we mean lack of support from coworkers and sort of bosses or supervisors. So I guess the other way of thinking, flipping it on its head, one way of combating stress would be to find support in the workplace, right? To find communities in the workplace that can mutually support each other and help each other out in workplace, sort of workplace issues. So I think, in a sense, that'll be my personal sort of observations on this. Yeah.
I like that, and I like the fact that you mentioned, that maybe certain, and this is what I understood, was that certain types of jobs may have different kinds of stress associated with them. There may be certain roles that are inherently more stressful than other roles.
That's right.
Versus the environment, maybe something is very dysfunctional that could be different in a different company. So there's some things that may change, other things that may not change. And the other thing you mentioned was the family issue. And that was one thing when I saw this study, and at least the summary of the study, I wasn't completely clear on. Can you explain that a little bit, the family conflict piece?
Yep. So I think part of one of the stresses that has been sort of studied and identified in the literature is this stressor that's commonly called work-to-family conflict or family-to-work conflict. And academicians will distinguish between the two. But for a simplistically, we'll just call it sort of work-family conflict. Mm-hmm. And what this means as well, in a sense, the commitments in your job sort of overlap with commitments in your family. Or in a sense, employees that feel overburdened with both one's family commitments and job commitments. And there are various ways that this can occur. For example, if and this is in a sense correlated with some of the other stresses, but in jobs where one has to work, say, odd hours, that tends to occur more frequently. Or in jobs where there's unpredictable amount of work, or where work tends to be, or where overtime is very unpredictable, that can be a source of constraint for employees. And even though we recognize that stress is not completely under the control of a manager or under the control of a company, for example, that does often vary quite significantly with one's personal family situation. People have, or at least researchers have sort of identified that as one of one stressor that tends to be quite negatively correlated with health as well.
I could see that. Okay, that makes a lot of sense. I'm curious, in your research, did you find anything that would say that different people respond to stress differently? Like one person might have more stress from a particular situation than another person?
So that's not what we find in our personal research, but I'm pretty sure that there's research that would study that under what is called the coping literature in psychology, where people would have different coping mechanisms for dealing with stress, and some of it, of course, would be more effective than others. Unfortunately, I only know of it from a third-hand perspective, so
Sure.
I don't have a lot of insight to offer about that.
No, that makes sense. So also from your personal perspective, do you think there's sort of a point at which stress in our work, it maybe has escalated to a certain level and we should go and look for a new job? Is there a point at which, we should consider the stress is too high?
I think that's really a personal decision to a large degree. I would say some things that would sort of I guess some things that I would consider in evaluating how much stress I would have at work would be sort of along a couple of dimensions. Well, what is the frequency of the stress? Is this something that occurs daily, monthly, or is it once every 6 months? Right? Are there intense periods that come about every now and then, or is this sort of a routine affair? Right? And the more frequently that one gets affected by it, that sort of raises that becomes an increasing concern. Another question that I would ask myself, I guess, would be, how intense is the stress? Right? Am I mildly stressed? Do I feel that has? Are there physiological sort of effects that I'm already feeling from these intense periods of stress? So again, the higher the intensity, that would raise my propensity for thinking maybe there's not something I want to be doing. The other sort of thing would be and this might be difficult for individuals to reflect on, but I think it's a good exercise nonetheless. Is how am I responding to this stress? Right? Am I doing things that are to mitigate or cope with the stress that are ultimately unhealthy? Am I overeating? Am I eating unhealthily? Am I abusing alcohol or something like that? And if I'm doing that on a fairly frequent basis to encounter high levels of stress, then maybe that to me would raise some red flags. Right, and ultimately, I guess again, it's an individual's decision of how much stress am I willing to take, or do I think I can take before I sort of call it quits. But to me, these would be the dimensions that I would sort of think about as I evaluate the environment that I'm working in, and whether or not that's an environment that I want to be in or I'm adequately compensated for.
No, that makes a lot of sense. I really like that. I like how you thought about it in terms of quantity, sort of how frequent is this happening and how intense is it. As I speak to people, there are a couple of things that I often see as well. One is if the person is to the point where they're crying on a regular basis, that to me is kind of a sign. And the other is if the person feels unsafe.
Yes.
I had spoken to someone at one point whose boss was throwing things in the office and they felt very unsafe. So I think, those kinds of signs are important to pay attention to.
Oh, definitely, yeah. Those
Yeah.
would be, I think, definite red flags in my view too.
Right. But I do think it is important to kind of reflect internally to see if I change jobs, will these problems go away or will they come with me?
That's right. That's right.
And that
And
kind of,
it may be an industry sort of thing as well, right? If you're certain industries might be, and so switching a job might not completely solve the problem within the same space, if you will.
you could recreate the same issues somewhere else.
That's right.
Yeah, that makes a lot of sense. So kind of based on what you've seen with your research, what sort of things should we be looking for at a new company if we do go and we're interviewing somewhere? What would be some signs that things might be doing well, things are going well there in terms of stress in the workplace?
That's a tough question for me, to be frank. I don't have a ton of insight on this. I'm guessing you have a lot more insight than I do on this question. But my sort of sense would be, and the reason I say this is it's often difficult to parse out, in the interviewing phase, what is reality from what is spin, if you will. And so and perhaps in your other coaching, maybe you have some insight on how to do that. But I guess assuming that you can sort of get a rough sense of the culture, I think understanding from your the potential coworkers what the environment is like and whether they enjoy what they're doing, how even metrics like how often one works overtime or how often one has to pull weekends. Those would be useful. Again, it's probably difficult to get that out of people at the interviewing stage or even after there's a job offer on the table. But I think insofar as one can get some of this information, it will probably be helpful. But I think it's a really tough. That's a tough question.
Yeah, it is
for employees to figure out. Yeah,
it is tough to know. I like to look at things like I'm a numbers person as well, so I like to look at things like how has the company stock been doing over time, or have they ever had layoffs in the past? Sort of what decisions are the executives making?
Yep.
Things like that. And then there are also websites like Glassdoor.com that allow employees to leave ratings of a company, ratings and reviews, similar to like if you stayed at a hotel and you had a bad experience, you could, put something about that.
Yeah.
So it allows you to, and the employee is able to report that anonymously. So you can find some good data in terms of, do people like it or not?
I see. Yeah.
Yeah,
and they'll probably be a lot more accurate than just your conversations with people, I guess.
Right, because obviously the people you speak with in the interview, as you alluded to, they have an ulterior motive. They're trying to get you to come to the company.
Yeah, that's exactly it.
They may not tell you everything.
Yeah.
Well, we've covered a lot of different things. Is there any other advice that you'd like to share with us today in terms of things you've learned from your research that we might keep in mind?
Not entirely. I don't know if I'm really in a position to give advice, but I think maybe I'll share something that struck me, that I learned from doing this research that perhaps I didn't learn before, and I think something that I came to realize was that, well, and it's sort of in a sense almost trivial now that I think about it, but in a sense where we spend a lot of time at work. For the most part, most of us spend like a third of the day or more at work, and we're not at work. We're thinking about work, right? For some of us, and so it's not unexpected that that work or the stress that we face at work affects our health. And I think to the degree that we're concerned about our health, we really should be thinking about how we are reacting to stress at work, or how we are, or the workplace that we're in, as a potential locus for where the stress emanates from. And I think the question then is, are there ways we can personally cope with the stress? Can we sort of be a bit more thoughtful about the ways we're coping with the stress? Are our coping mechanisms themselves unhealthy? And are there ways that perhaps, unexplored ways where we could be talking to our managers about how perhaps jobs could be redesigned or thought through a little bit better in order to to mitigate some of these stresses, and while yet sort of not compromising things like productivity.
Mm-hmm.
So, and I guess that was a long and meandering way of saying it. I think stress at work really matters, and I think we sort of intuitively know this, perhaps, but I think what I learned from this study, it matters in a sense a lot more than what I had imagined, and so.
That's great. I think that's excellent advice. Well, so if anyone who's listening is interested to learn more about your study, where should they go?
I guess they could check out the articles themselves from the journals. They could look at my website. They could look at my co-authors' websites, where we talk about where we have links to the study, and one of my co-authors, Jeff, writes for a column, and I think it's in the San Francisco Chronicle, if I remember correctly. Mm-hmm. And he talks about some of these issues as well.
Oh, that's great. Well, I will put a link to your website in the show notes so that people can find it.
Okay, thank you.
Great. Well, Joel, thank you so much for joining me today. The discussion's been very helpful.
Well, thank you so much, Angela. Yeah.
Thanks, everyone, for listening. Tune in next week for another edition of the Copeland Coaching Podcast. And if you haven't already, please be sure to subscribe on iTunes or Stitcher to ensure you never miss an episode.
Thank you for listening to the Copeland Coaching Podcast today with your host, Angela Copeland. Tune in next time to get more great tips on turning your job search into a slam dunk.